bilaterally to really try to decrease the depth of this defect. And I really think that part of what you're seeing now is just the residual effect of the defect. It has not completely corrected itself, but it's really a remarkable difference from the appearance before we injected him. If you'll smile. It looks very natural. He has a lovely smile, and it does not really deepen that much when he smiles, which I think really helps to give you the impression that he doesn't have very deep folds. Again, as I said, the shadow here I think has to do with the fact that it hasn't completely corrected. It's only been 2 weeks, and over time I think this shadow will lighten, but we've gotten really an excellent result from the treatment. I'm going to point out some features on Laura that we want to correct. The first is the depression at the nasolabial groove, or nasolabial fold. Here on both sides, it's fairly deep. We're going to try to get at least a 50% correction of that and smooth this area out a little bit for Laura. She's also got the mellomental fold here, or the marionette lines, and they also need to be corrected. And then she's got this fold here right under her lower lip, the mental groove, and that can be corrected 2 ways. One is to inject some Botox here in the mentalis to help to relax this muscle so that it doesn't pull up like that. And the other way is to inject some filler into the depression itself to try to make the chin a little bit more uniform. So we're going to do the injection today. I'm going to be using the Radius. This is a subcutaneous injection, and we'll be using linear threading. She's already received some topical as well as subcutaneous anesthetic, 1% lidocaine without epinephrine. And so we're going to get started. I'm also going to be asking her to ice periodically because Laura's very sensitive, and I just want to make sure that we're getting enough anesthetic. Many people just use ice, which actually works as a very excellent anesthetic for topical applications. And you just have to be sure the patient isn't going to leave the ice on long enough to burn her, but it can work quite nicely. Okay, so we're going to start here. We're going to try to get as much up by the nose as possible because that's where we're going to need our major correction. We're trying to deposit about 0.05 cc's with each pass. And trying to make sure we don't withdraw the needle until we're ready to go into another area. And that little dot there is the calcium hydroxyapatite. You want to squeeze that out, otherwise you get a little bump in that area, because that at that point is intradermal. Go a little bit lower here, sorry. And again, the linear threading. As you deliver the filler, it's going to get a little bit easier. There's not as much in the syringe, so you'll have to adjust the tension on the plunger accordingly. Now I'm going to do a little bit of fanning from the side. See if we can cross-hatch this to get the maximum benefit. I'm just trying to make sure I'm right in the subcutaneous plane. You can see the needle bending a little bit. That's one of the reasons why we actually bend it ourselves, so that we have the right angle here. Just going to come up just a bit. Try to get a little bit more. I'm sorry here. You can see she's sensitive. Are you okay? Okay, and just a little bit more down in this area. I've injected 0.4 cc's into the nasolabial fold. I'm just going to move straight down to the mellomental fold, or the marionette line, since we're on this side. We'll be developing a plane in the subcutaneous tissue. I'm actually going to go perpendicular to the line first to see how much elevation we can get, and then if I need to, then I will go parallel. So I'm starting low. Trying to keep enough tension on the tissue so that it doesn't move too much with my needle. You can almost see it there underneath the skin. I'll elevate it a bit. You can see that it's in the correct plane. I'm going to fan it right up here. Did the ice help?
Yes.
So we already have a nice correction. I'm going to actually come to this side to go crosshatch it this way now. I'm just going to go in just as I would parallel. This is swelling here. I've not injected anything in this area, but swelling occurs very quickly. Sorry. Okay, so you can see the difference between the depth of these two lines. This line is almost completely eliminated. When this swelling goes down, she'll have a very beautiful flatness here. And we're just going to creep along to the other side, start with the nasolabial fold, and see what kind of resolution we can get with that problem. So I'm going to start here. She has more sensitivity with the needle going through the skin than once we're in. I'm still going to ask her to ice in between just to make sure that we're getting enough numbing. Linear threading.